I want to start by showing you this photograph here. This is a picture of the underside of someone's tongue called the floor of the mouth. And sadly, what we see in this picture is a rather large tumour called a cancer of the mouth. Now, together, cancers of the mouth with cancers of the throat and the voice box are called head and neck cancers. And globally, they're the 6th most common type of cancer. So, unfortunately, across the world, the rates of these cancers are actually static or increasing. Now, the risk factors for these cancers include smoking tobacco, drinking alcohol, low socioeconomic status, and also HPV, human papillomavirus. And interestingly, today is World HPV Awareness Day, so there you go. One of the biggest things about these cancers is the proportion of patients who are diagnosed with late-stage disease, which essentially means a large tumour and/or the cancer is spread to other parts of the body. Over 60% of patients with these diseases come in at a late stage. Now, the treatment for these cancers is very, very invasive. It involves radical facial surgery to reconstruct what's going on after what's taken away, and also some intensive chemo and radiotherapy. Now, what that does is it affects so many aspects of life we take for granted. It affects talking, chewing, swallowing. It involves tasting. It involves being the ability to kiss your partner. It sometimes involves the eyes and other parts of the face as well, depending on where the cancer is. But what we do know is that when we catch these cancers early enough, they are readily treatable, and we can save that patient from undergoing a lot of disfiguration, but also can really vastly increase their chances of survival. And my question is, why are we still seeing so many of these patients at such a late stage? What is it about them? What is it about their environments and the healthcare systems which means we're not catching them early? So what we're doing is a mixed method study. We're doing 3 approaches. One is we've got an 1,100 patient cohort study between 11 centres in Europe and South America to really analyse those patients and the tumours. We're also doing a benchmarking process across 11 centres to map out the healthcare system. And we're doing a qualitative deep dive in 2 areas, here in Glasgow and also in Montevideo in Uruguay, to interview these patients and the staff members to see what it is about the healthcare systems that can potentially be improved. We're going to apply the science of human factors and healthcare ergonomics to really understand both continents, because actually, as much as they're very different, they have very similar burdens of disease. And back to our patient, he is a gentleman who came in after seeing this in his mouth about 3 months. He didn't go to see the doctor. He didn't realise he could go see a dentist because he didn't have any teeth and hadn't seen one for years. He eventually did get treatment and survived, but it had a major effect on his quality of life. And sadly, we know that not everybody gets the chance to kind of carry on past that. So we need to catch these early, because otherwise it's too late. Thank you very much.